If you are having fungal infection and if you are taking treatment for many months or maybe many years and wondering why your infection is not getting cured, this video is for you. In this video, we are going to discuss about the types of fungal infections, why it doesn't get cured, some important useful tips to prevent fungal infections and to cure the fungal infections effectively. I'm your friend Dr. Shail Gupta and I'm a practicing dermatologist and has been practicing it for past 18, 19 years now. So if you haven't already subscribed our channel, please subscribe it right now, and to receive all the notifications, don't forget to press the bell icon. So fungal infection of skin is a very common problem. It can involve practically all the areas from head to toe. It is more commonly seen in people who live in areas where it is hot and humid, though it can affect people living in cold countries as well. So when I started my practice, I'm talking about see around 18, 19 years back. At that time, the fungal infection treatment was pretty simple. Uh, we used to give some antifungals for a couple of weeks, and sometimes even oral medications were not needed at all, and just topical medicines used to do the work. But over a period of time, especially last 5 6 years, there is a rampant increase in uh, prevalence of resistant fungal infections. So what happens in such cases? Either the infection doesn't get treated, there is just partial relief in symptoms, or if it gets cured, it tends to come back. The chances of relapse in such infections are really high. The probable reason why it happens is resistance developed in the microorganisms. As you all might be knowing that there are mosquito repellents available in the market. When they were launched few decades back, they used to work very nicely and used to kill or control mosquito population in that particular area. But these days, uh, we don't see any effective mosquito repellent because in most of the cases, these mosquito species have acquired resistance to these chemicals, so they don't work. Companies keep on changing their salts, their preparations, they come up with new formulations, but to no avail. So exactly the same thing is happening with pesticides, and antifungals are no exception. What we are seeing these days, uh, like initially there was a medicine, uh, and then the first generation medicine, then second generation came, third generation came. Recently also, like just 2 3 years back, there was another medicine introduced which is given orally, pretty strong, good medicine. Initially we used to see results with that medicine. Now even this medicine also doesn't work. I'm intentionally not taking names because I don't want you to purchase this medicine, go to chemist and purchase the medicine, and do self treatments, because one of the reasons why antifungals have become ineffective and why these infections have become kind of incurable is improper use of medicine, self usage, uh, improper dosage, and duration. So, in this video, we are not going to name any medication, so that just to avoid self medication. So, in case you have any problem, you must consult a dermatologist. The purpose of making this video is just to educate you about the importance of proper usage of medicine and some important tips which can help you to fight out the fungal infection well. So, the commonest reason of developing resistance is use of steroids. A lot of people in India, they use steroids. They use creams prescribed by their physicians, or sometimes chemists, or sometimes recommended by friends, and family. So most of these creams are steroids. I have made separate videos on steroid misuse. The link is given in the description. Please go through the video, that's quite informative. Just to name a few steroids which are very popular, which people use: Forderm, Quadiderm, Tiboderm, Tinovate, Lopate GM, Candid B, Surfaz SN, Metnovate, and so on. So most of the medicines which have their salt ending like son or sol, they have steroids in it. So, just go through the composition, the salt of the medicine, and if you find something like this, please don't use it if it is not recommended by a doctor. Why do people use steroids when they are so harmful? Steroids are good medicines for steroid responsive dermatosis. There are many skin conditions where we have to use steroids, and steroids are like meant to be given in those conditions, and they really help. But when you use it in infectious conditions like fungal infection, the inflammation is reduced immediately, you get symptomatic relief immediately, the burning, the itching, redness and the rash disappears in almost 1 or 2 applications, and then the patient feels very happy and keeps on using it off and on. Sometimes when it happens, they apply it, then they leave it. So this goes on and on, and the problem is resistance. The moment you stop using it, the condition tends to come back. The size of lesions also increase. So there is a special term which has been given to this, that's called tinea incognito. I'll be discussing about tinea incognito when I discuss the types of fungal infections. So second reason is improper dosage or duration. Sometimes people use the medicine for less than the duration for which it has been prescribed. So that creates a problem because the fungal activity is only suppressed and it comes back with a boom, and the fungus becomes stronger. You must have heard that what doesn't kill me makes me strong. So what doesn't kill that fungus makes the fungus stronger. So use the medicine for prescribed preparation. So you have to use the medicine for the duration it has been prescribed. Even if you get symptomatic relief, please don't leave the medicine in between. Consult your doctor. Now these days, because of all this, primarily people are affected by resistant strains. Now coming to the types of fungal infection. So as I've told you, it can involve practically any area from head to toe. So let's start from head. Tinea capitis is the term coined for fungal infection of head, where you can have some bald patches, you can have scaling, you can have some greyish patch also, sometimes you can see boils, and this leads to hair loss, patchy hair loss. Sometimes it is diffuse also and involves the entire scalp. This is commonly seen in children and it is not seen in adults. So adults are not affected. Generally after puberty, this condition doesn't affect a person because of the oil secretion which happens in the glands. The fungus is not able to survive there. The hair loss seen in this condition is reversible in most of the cases, but sometimes inflammatory type tinea capitis hair might not come back at all. Now tinea can involve the face, which is called tinea faciae. The classical presentation of fungal infection, tinea infection, is round circular rash which is clear from center and which enlarges at the periphery margins. So then another area which can get involved is oral cavity. You can have oral thrush caused by candidal infection. The skin in this area sometimes becomes reddish or erosive, or sometimes there are white plaques there. Then it can also involve body in the form of tinea corporis. You can have rashes all around, almost all the body can be affected by this, as you can see in the pictures. Then the commonest type is tinea cruris, which involves the groin area. thighs, and this is very common because this area is hot, this area is humid, and less aerated, so you can see infection. That is the ideal environment for fungus to grow. Fungal infection can also involve genitals. So in males, it is seen as candidal balanoposthitis, commonly caused by candida, and you can have erosions or sometimes some deposits on the skin of glands or on the skin of glands or prepuce. In females, it can present as white discharge, foul smelling odor, and sometimes vaginal itching. Tinea can also involve hands and feet. So, in hands you can have tinea manum, in the feet you can have tinea pedis. The web spaces can also be affected like any other skin fold, and you can have sometimes even cuts and which are painful and itchy. It is more commonly seen in people who tend to wear shoes for long periods. It tends to happen more commonly in people who wear shoes for long periods. Fungal infection can also involve nails. It can involve nails by affecting the nail structure. That is seen in onychomycosis, where the nail becomes thick, blackish or yellowish. It becomes brittle also, and it becomes very very thick. Sometimes later on it can become powdery, and the nail is lost. There is another condition called paronychia, where the cuticle is lost, and there is a gap created between the nail and the skin. So the joining area which holds it up is lost, and then you can have swelling and sometimes pain. Sometimes pus also might get filled there when the condition is called acute paronychia. It is more commonly seen in housewives who are involved in activities involving water. So, as far as treatment of fungal infections is concerned, there are oral medicines, there are creams, there are powders, there are some injectable medicines also. The duration of the treatment depends on the site affected. For example, when it involves skin, usually we give medications for 2 weeks, 3 weeks these days, but we have to give the medicines for longer period of time because of non-responding strains. Now, in some patients, we have to give medicines for longer period of time, maybe a couple of months or sometimes even more. Especially patients who have fungal infection in nails, onychomycosis, the duration of treatment is pretty long. Please make sure that you are taking treatment from a qualified dermatologist, and you take the treatment for proper time for the duration for which it has been suggested to you. Never leave the treatment in between. Now, there are some useful tips, some important precautions which you can take to avoid fungal infections and to cure fungal infections if you already have it. As we know, fungus prefers moisture, so it is very important that when you are involved in activities where you sweat, make sure that you change your inners as soon as possible. Maybe you can take a shower and then that would be even better. But in case you don't have time to take a shower, please at least change your inners. That is very important, especially when you go to gym or are involved in any sport activity. That becomes very important. The clothing also is very important. Make sure that you wear cotton clothes, cotton inners, especially when the weather is hot or humid. Make sure that you don't wear tight clothes, especially people wear jeans or tight trousers. That's not gonna help the cause. When you take a bath, make sure that you gently dab all the area. Don't let moisture remain in the folds. That's very important, especially when you take a bath. Make sure that you make the areas which are prone to fungal infection dry, like thighs, like the toes, the web space between the toes. That's very important. Another important tip, that it's better if you use shower gel rather than using soap, which might get contaminated amongst your family members. Never wear same inners. Sometimes people use same towels also, in the siblings, and it is not good. It is not good because fungal infections are contagious. Even the towel, you have to, make sure that the towel is also not wet. You have to clean it daily, plus sun exposure to the towel, that is again very important. Don't let it be damp. People who have fungal infection in toes, they should avoid wearing shoes in case they are working in corporate sector where they have to wear shoes. They can wear shoes which have some aeration provision there, like the good shoes come which have some holes in it, and so that air can pass through. And whenever you get time, as soon as possible, or maybe in between, if you get time, remove the shoes. Antifungal dusting powders are available in the market. You can put it in the areas, especially during rainy season. That is again very important because it will help in preventing the infection, especially if you have a tendency to catch the infection again and again. Another important and very useful tip is sun exposure. Uh, Sun has got real good antifungal, antiseptic, anti-infective properties. Sunlight is magical and it heals almost anything. So sun exposure to the areas which have fungal infection will really help you. I have been doing this for my patients for many years now, and it gives wonderful results, especially in patients who have resistant infections. Bathing is amazing. Try that. Try it. And it is good for your health also. So just a final tip, always consult a dermatologist. Fungal infections are difficult to treat but not impossible. Never use any medicine which is not prescribed by a dermatologist. Never recommend the medicine which has been prescribed to you to your friends or family. Okay? Because his or her condition might be different. It is only because of self medication we are seeing these resistant cases. I hope this video gives you a good information. Subscribe our channel if you haven't already subscribed it, and don't forget to press the bell icon to receive all the notifications. You can also follow me on Facebook, Twitter and Instagram. We keep on posting useful stuff there as well. Thank you very much for watching the video till end. Thank you very much. Love yourself. Stay blessed.